Chicago. Welcome to Community Post, a bi-weekly CAN TV program featuring our local leaders and organizations. We focus on improving health and well-being in the city of Chicago. Community Post is presented by Foxglove Alliance, a public health care coalition supported by the Hectone Institute of Medicine, in partnership with the Healthcare Council of Chicago, managed by Third Horizon Strategies. Such a mouthful, but here we are. My name is Tacora Love. I am one of the Community Post rotating hosts. We are so very fortunate to have Dr. Judith Paice in our audience today. I should say in our studio for our audience. We are just so very fortunate. Thank you so much. And as you guys can see, we're matching.
Yes, we got the memo.
We got the memo. So absolutely love it. So Dr. Judith Paice, welcome. Thank you.
Thank you,
It is an
Tacora.
honor and a privilege to have you in our studio. Can you tell our audience a little bit about who is Dr. Judith Paice?
Oh my goodness, sure. So I am a nurse. And I always preface any introduction by letting people know that I'm a very proud nurse. I've been a nurse for a long time. I won't say how much, but so I was very fortunate to choose a profession that I've loved and have never regretted being involved with. I mean, it is an amazing profession. It's an amazing calling, a passion.
Definitely.
And what I advise people who are interested in becoming a nurse is to let them know the various roles that people can play.
Yes.
So, yeah.
Oh, I love it. I feel the passion. I share the passion.
I know you do.
As many know, I am a nurse as well. Just very fortunate. As you mentioned, like it's a calling. It is a passion. It's a purpose. So absolutely love it. So when we talk about a little bit about, nursing, can you share your why for wanting to become a nurse? And then just to highlight your journey to fulfilling your dream.
Sure, yes. So Tacora, I'm going to be really honest with you.
Yes.
I was the first in my family to go to college, and it's been a long time ago. And for women in particular, the primary directions that were being advised were teaching or nursing.
Yes.
So, and my family was so wonderful, so supportive. It was interesting, the advisors in my high school, some were saying, oh, go to community college, save your family money. And yet there was something in me that wanted to go to a university or college. And I was so lucky to find a wonderful fit. And I loved science. I loved being with people. And I know it sounds, it sounds like, something that everybody says, but I really wanted to help people and change the world. And through nursing, you really can.
You really can.
So I started out as a brand new staff nurse after graduation. I knew from my clinical rotations during nursing school, I loved oncology. I loved the complexity of the disease, and I loved the way it really affected all aspects of an individual and their family.
And their family.
Yes, so, and as a nurse, I could address all of these different aspects and include the family as well. So I worked on an inpatient oncology unit. I loved the experience. I learned a lot in those first,
for sure.
Yeah.
It's humbling, definitely.
It's extremely humbling. And I worked at an institution where resources were a little bit tight, and we could have to work, this was 8-hour shift days, no 12-hour shifts in those days. So we worked maybe a day shift, and then I might have to come back for a night shift. There were times when I worked 3 different shifts in 1 week. It's a good thing I was a younger person at that time.
We had the energy to do that, right?
That's right. But it really gave me confidence because I saw all sorts of medical challenges, psychological issues, social concerns, spiritual concerns. And it just reinforced the passion that I felt for this profession. I then was mentored by some wonderful colleagues, and they advised me to consider going back for a master's degree. I did the prerequisite year in the intensive care unit, which, you know what? Everybody wanted to take care of the patients who had just undergone cardiac surgery. I gravitated to the cancer patients even when I was in the ICU. So I really enjoyed oncology. Went and got my master's degree at Rush University for oncology. They had an oncology program at that time. And the model at Rush was to be a practitioner, so a clinician and an educator. And they also expected that there would be some education and leadership as well. So there were really 4 components, and I really gravitated to that role because it provided me with such a rich experience. So part of my research was studying pain with a neurosurgeon who was investigating new drugs. So I really had felt in my original career that we did a terrible job with pain management.
Yes.
Even in oncology, where we really needed to do a better job. So I was able to build those research skills, and we made some amazing discoveries. And then I found myself in a lot of research settings or meetings.
I was going to ask that.
Yeah, where it was Dr. Smith and Dr. Jones and Judy. And I also found myself wanting more of the science. So I went back for my PhD, and I did that at the University of Illinois. And had a wonderful advisor who was very open to me studying a little bit of an unorthodox kind of curriculum.
Absolutely. Well, I can feel it, so I'm sure the audience can feel just your joy and your passion, not only for nursing, but in the specialty of oncology.
Yes.
You know, and it definitely takes a special nurse and a special healthcare provider to work in that area. And I feel like the therapeutic tone, like I feel all of that now. Thank you. So your passion for pain was ignited when you were doing your research. What is it about pain that has drawn you in? Because you are a world-renowned pain expert.
Thank you for saying that.
Yes.
So those initial days as a brand new staff nurse, working with people, and cancer was a very different entity at that time. We've made extraordinary advances, but at that time, people with advanced lung cancer lived 6 months if they were lucky. Melanoma, 4 to 6 months. Myeloma, 6 months. These are diseases now that have become chronic illnesses. So at that point, we were caring for a lot of people with end-of-life issues. And we didn't do a good job with pain management, and yet we had the tools. And you know what? There was a lot of moral distress to observe the patient in such distress and discomfort, and then to watch the consequences on the family. So that began my passion, knowing we could do a better job and trying to understand, how can we do this better job? How can we educate others? How can we learn more about pain? How can we change some of the laws that make it difficult? So advocating. So that's the other beauty of feeling a passion, is knowing that you can really see a problem and see the multiple ways in which a problem can be resolved. Now, pain is a bit challenging because of things that have happened in the intervening period. So
I want to talk a little bit about that. As a world-renowned pain expert, what myth would you like to dispel about pain? You know, I think that for me, and you know, I'm probably dating myself, but you know, the definition of pain is what we learned. Pain is exactly what the patient says it is. You know, but we know that this day and age, that may not necessarily be true. We have a lot of pain that still is not managed well. So one, what myth would you like to dispel about that? And then I'll go into my next question about pain.
Sure. So, boy, there's so much that you've just said that's
that
so
was
important.
loaded.
Yeah, it is. So the overall myth is that pain isn't important.
Yes.
I mean, I've heard some clinicians say, I've never seen anyone die from pain. I don't think that's true.
Right, I would agree with you.
Yeah, that pain is a biologic, a psychologic, a social, and a spiritual phenomenon.
Yes.
And I teach all my patients that yes, we can give pills that will hit the biologic, but there are effects on your mood. There are effects on your social life.
Yes.
What about the existential and the spiritual? It doesn't just have to be religion. It can be, what is the meaning of my life? What is my purpose if I'm in so much pain that I can't fulfill my role? I can't be a mom or a dad or a daughter or a teacher, or if I can't be something in this world and I can't contribute to this world. So when we treat pain, we need to address all of those. And so I'd love for the public to know that it is important to relieve pain. It is important to address all those components. And so if your doctor or nurse or other healthcare provider says, I really would love physical therapy for you, it doesn't mean that they think the pain is in your head or that you're lazy.
Right.
But we know that movement
Yes.
is so essential. We know that for many people, therapy like cognitive behavioral therapy, other kinds of emotional kinds of mood therapies can help you find your inner strength to address this adversity.
Wow.
And the same, addressing these existential questions about why me. All of that is important. Now, you just talked about the definition of pain.
Yes.
And I also was taught that pain is whatever the person says it is. And I was also taught a more scientific definition that pain is a change in the physical and emotional. It is a physical and emotional phenomenon, right? And it's both of those. The person who originated that definition, that pain is whatever the person says it is, was a brilliant woman named Margot McCaffrey, a real leader who has left our world now. And she really went out on a limb. And there are some people who question that definition, thinking that it wasn't scientific enough.
Absolutely.
And there are some who have blamed her definition to be a cause of the opioid epidemic. But Margot never said, pain is whatever the person says it is, so give them all the morphine that they've ever wanted.
Yes.
She was really trying to help us understand that one person's expression of pain and interpretation of pain is going to be very different than another's. And we have to really consider the whole person.
Yes. Oh my gosh.
That was a lot.
That was good.
Yeah.
That was good. What advice would you offer about pain management to our audience?
Yeah. So for those of you who are patients that might be listening, or people with the lived experience of pain, I know that it's very hard to find clinicians now who are interested in pain management, and that makes me extremely sad. It is a challenge. But really, don't give up. And for many, what I would really advise people to do is kind of take the time to chronicle your experience, help your clinician, your doctor, nurse, whomever you end up working with, to help them understand this history of your pain, and try to think about all of the who, what, when, how kinds of questions. So where is the pain? For many people, it's multiple sites, right? What does it feel like? What seems to make it worse? What makes it better? What is the periodicity of the pain? Do I notice more in the evening, in the morning? All of those kinds of questions, the more you can kind of write them down and document them for your visit with your provider, the more rich and meaningful the experience will be. You're giving them the data that they need. So for people with lived experience, really also try to document, what have you tried for many
that's an
periods?
awesome
Yeah.
point. Yes.
Have we already done physical therapy? Have I already done cognitive behavioral therapy? Have I joined a support group? Am I walking around the block? Have I joined silver sneakers?
Oh, I love silver
And then
sneakers.
what medicines have I tried?
Yes.
And what worked?
Wow.
What caused side effects?
Wow. No, that is very, very good advice. Very, very good advice. What advice would you give to healthcare providers in terms of pain management?
A crucial message is that not everybody who gets an opioid will develop addiction. There is this misperception right now that anybody who benefits from an opioid must have addictive disease or substance use disorder. The data really suggest, at least in the cancer world, less than 10% of people will develop substance use disorder. And it is, we know the risk factors. It is not preordained.
Yes.
And so for healthcare professionals, get that additional training, understand what the risk factors are, assess those risk factors when you meet a new patient. That doesn't mean that they can't get pain medicines. I treat many people with cancer or of a serious illness. They absolutely, ethically need treatment for their pain. And at the same time, I'm going to have different levels of risk mitigation based upon the risk factors that they bring to us.
Wow. I feel like this needs to be a series. Like, I think we're going to have you back for part 2 and part 3, because I think there's just so many questions, to ask, and just so much information to get out to our audience. Thank you so much for joining us today, Dr. Judith Paice, Nurse Paice. I love it. It is time to wrap up. So again, thank you so much. I want to extend gratitude to the Academy of Medical Surgical Nursing, as well as Hectone Institute of Medicine, Nurses and Humanity. Also, would like to thank CAN TV, Nonprofit Services, Channel 21 for their support of this production. Again, my name is Tacora Love. Thank you for watching Community Post, Channel 21, which airs on CAN TV and cantv.org. Have a great day, Chicago. Bye-bye.